What are the challenges in diagnosing seronegative RA? Diagnosing seronegative rheumatoid arthritis can be quite tricky. The usual blood tests that help confirm rheumatoid arthritis, like rheumatoid factor and anticyclic citrullinated peptide antibodies, are often not present in seronegative patients. This absence makes it harder for doctors to make a quick diagnosis since these antibodies are key indicators in identifying the condition. Without them, healthcare providers must focus more on clinical symptoms, imaging, and other lab results, which can sometimes be less clear-cut. One major challenge is the lack of specific blood markers. In fact, only about 60 to 80% of rheumatoid arthritis cases show positive results for these antibodies. This means that for seronegative patients, distinguishing their condition from other types of arthritis or joint diseases using blood tests alone can be quite difficult. Another issue arises from the overlapping symptoms with other diseases. Symptoms like joint pain, swelling, and stiffness can also be seen in conditions such as spondyloarthritis or psoriatic arthritis. This overlap means that doctors need to conduct careful differential diagnoses, which may requiring long-term follow-up to clarify what is going on. Additionally, the clinical presentation of seronegative rheumatoid arthritis can be nonspecific. Early symptoms may be intermittent and not very pronounced, leading to uncertainty in diagnosis. Inflammatory markers like erythrocyte sedimentation rate and C-reactive protein may be elevated, but these markers are not exclusive to rheumatoid arthritis. Imaging techniques such as X-rays can show joint inflammation and damage, but early changes might be subtle or even absent. This can delay confirmation of the diagnosis. Because of these challenges, patients often need multiple evaluations, sometimes involving rheumatologists and other specialists over time, to reach a definitive diagnosis. One significant risk associated with these diagnostic difficulties is the potential for delayed treatment. Without clear serological markers, there is a chance of underdiagnosis or a delayed diagnosis. This can result in missing the critical window of opportunity for early intervention with disease-modifying antirheumatic drugs, which are crucial in preventing joint damage and disability. In summary, diagnosing seronegative rheumatoid arthritis relies heavily on evaluating clinical symptoms, imaging findings, and inflammatory markers rather than just blood tests. This complexity requires careful and often prolonged assessments to differentiate seronegative rheumatoid arthritis from other similar conditions and to ensure timely treatment. Always consult with a healthcare professional for personalized advice and guidance.